AIDS can be a frightening disease, but now there's an organization that offers important services for individuals who test positive for the AIDS virus or for interested friends or loved ones. This organization provides an information line and referral service to answer questions about AIDS, employment, financial planning, or schooling. They provide a weekly support group and a speakers bureau which provides community organizations with clear, accurate information. AIDS can be a frightening disease without help. Contact the Southern Colorado AIDS Project.
My friends were sick, and many were dying, and people were dying within 3-4 months. So it was also a very personal endeavor for me, and we didn't know where it would go. We didn't know if anybody would show up when we called the community meeting. We didn't know what kind of impact we would have. We didn't know what kind of adversity we might encounter. But we did know that Colorado AIDS Project was in Denver, and so we thought, they can do it in Denver, we can do it here. It was pretty small, probably 8 people, some of whom were therapists in the community and helped us set up our programs for people living with AIDS or people concerned about getting AIDS. And then we had a couple of good organizers who put us in contact with people who could help us with our organizational structure, our bylaws, and our articles of incorporation. And then it kind of grew from there over time.
So 2 large areas of growth in the last 10 years for the organization. One is in health access. Our health access department helps enroll clients into Medicaid or insurance if they're eligible, and that has grown tenfold, and we're really thankful for the resources that are available to help get folks access to insurance and Medicaid where eligible, because that just is a game changer for their lives.
We went from seeing people be ill enough that they were losing jobs and housing and careers to being able to look ahead to plans for the future. In the past 16 years, we went from 37 clients to now being able to provide assistance, including prescription and medical copays and monthly medical premiums, to over 600 people in 2024.
The other area has been in our prevention services, largely our harm reduction services. There's still a lot of stigma around these services, but as we all know, nationwide and even globally, the opioid epidemic has increased tremendously in the last 10 years. And we've stepped up to the plate because we see that there's a need for our services there, and it falls within our mission to help prevent the spread of HIV and other health conditions. So that's something that we have embraced, and it's alarming that the numbers have increased so much, but our staff has been resilient, and our funders have come through eventually to provide some funding so that we can actually make a difference in these people's lives and work towards hopefully getting folks into treatment one day so that they can overcome their addiction.
If I had to pick out one area that I think has made tremendous impact and that they're doing especially well, I'd probably have to go with the syringe access part of prevention. Because it was, first of all, it was such a battle to even get it going.
The number of folks that we are serving as an organization and in Southern Colorado as well has increased. There are other smaller entities that can provide some of the services that we provide, but when folks learn about the services that we're providing and some of the benefits to those services, we've had folks move from other organizations to ours so they can receive those services with us.
Can have all the services. My wishes have a pharmacy there, have a Of course, the clinic, the dental clinic.
So the Colorado Springs and Southern Colorado community, we really need you to step up and join us. And that can mean anything from telling our story. Many of you have connections to the organization, sharing your story of why you're connected to the organization, why it means something to you. Of course, making contributions financially to support this work is needed. Also, sharing the word and linking us to others within your networks that may be able to help us as well is really important. We'll be talking to foundations, to businesses, to corporations, and looking to them for their financial support. This is something that none of us can do on our own, but if we bring all those folks, all of you folks together, I know we can move mountains.